Welcome to Massage Therapy Radio. I'm pleased to announce that we're joined today by Betsyann of Structural Myofacial Therapy.
Hello, Scott. Nice to meet you.
Pleased to meet you too. You've been doing this type of programs in different shows and teaching this type of technique, myofascial technique, for how long now?
I've been teaching this particular structural myofascial therapy for about a year now.
Oh, really?
It has evolved from another system that I had been teaching, and I found that I was exploring other avenues, and so I thought, well, if I want the freedom to explore, I should put the work together and go out and do it. So I am.
That's fantastic. I noticed that you were featured in Massage Therapy magazine.
Yeah.
And you're based out of Montreal, is that correct?
I am based out of Montreal. And Jill last year was writing a wonderful series in the magazine about massage therapy across Canada, and she asked me to write an article about how things are in Montreal.
Now, are you clinic-based right now?
I am. I have a group of massage therapists working for me, with me, within a physiotherapy setting. So we work synergistically with patients from physiotherapy and do the work that they don't. So we share for the good of the patient.
So this is a true interdisciplinary environment where you're working towards the common good of the client. That's fantastic.
It works great.
What else can you tell me about the therapy that you instruct and you teach seminars on? How does it help the average therapist in their practice?
This particular kind of therapy treats, and its intention is to treat the fascia, the fascial membrane. So if you get directly into these membranes and get them stretched out, more malleable, more plastic, then the muscle tissue within these membranes have more freedom. So it's efficient and gets in there and eases up the structure of the body very nicely and quickly.
So actually this type of therapy prepares the client. If the therapist also does, say, Swedish massage, they may start with this and finish maybe the Swedish massage, and it would be, if they're working the client, it might be easier on the therapist in the long term. Right?
You definitely can combine this work.
Yeah.
I think when I started learning the myofascial work, I also combined, and now I'm addicted only to myofascial work because it's efficient and complete, and the muscles, once they have the room to move, they do move. So also, I should say, when you're working deeply on the fascia, you are necessarily treating the muscle. You can't treat the fascia without treating what's inside it.
Which is good, because you're specializing. Inside of a clinic environment, you specialize. This is your area of specialty.
Right.
So there's other therapists that will do other type of work, whether it's Swedish massage or lymphatic drainage or craniosacral.
On my team, I do have therapists that do the other work. Everybody does the myofascial work, but I particularly specialize in it, and the others do the Swedish therapeutic and lymphatic drainage, and I also do cranial work.
Really? So when a client comes into you, how do you identify them that they would benefit from this type of therapy?
I only have those kind of clients now.
Okay.
I'm known that this is what I do.
So
so I get a lot of chronic people.
Okay.
And I have doctors and physiotherapists sending me people that.
Very good.
What can we do with this person? Don't know what to do. What can you do?
When this person walks in your door, what do you typically do? As soon as you're doing like a structural analysis or a gait analysis, stance analysis, that type of thing?
I do what I call postural somatic awareness.
Okay.
So this work is to help the person become aware of how they are, how they stand, what their relationship is with gravity, actually. So we talk about plumb line. So if you are in a vertical plumb line, then gravity has this really small pull on you, and it's very centered and grounded. But if you have poor posture, gravity has a much larger space, a much larger area on which to pull down earthward. So this brings us back to a center so that we can be longer and lengthened and move more easily, breathe more easily.
Really interesting. What is the average length of treatment with a myofascial treatment?
Oh, about 60 to 90 minutes, depending on what we've cooked up between the two of us.
Okay. Very good, very good. Well, I'd like to thank you, Betsyann, for joining us today on Massage Therapy Radio.
It was my pleasure.
Best of luck, and thank you for helping out massage therapists across Canada.
Thank you.
Appreciate it. Thank you.